I'm Amber Reed. I'm a licensed clinical social worker and a licensed clinical addictions counselor. James and I started Resolve in January of 2017 after we had known each other for a number of years. We worked together as directors in both an inpatient and outpatient psychiatric unit. And so we were really able to see, a lot of the struggles that people were having in accessing mental health services in the Kansas City community.
The goal of Resolve is to reimagine mental health, and one of the big pieces of that is reducing barriers. At your time of need is when you need it to be easy to get into mental health. And what we find instead is it's hard to get someone on the phone, it's hard to get scheduled. When you try to get an appointment, it can be 2-4 weeks out, and that's just not going to help when you need services right now.
Resolve has 3 main pillars that we focus on. First is quality care, high quality care for the community. That means that when someone comes to Resolve for services, they're not waiting to access our services. They're getting in immediately, and they're also getting with a specialized clinician, which is our second focus. We really want people not to come in and work with a generalist, but to work with someone who is specialized in the services that they need. When we talk about specialized clinicians, we were really intentional on who we brought onto our team. We wanted to be sure that the people that we brought on were highly qualified and highly trained. We don't have generalists in our practice, we have specialists. That being said, we always wanted to make sure that we could treat the whole family. So we have specialists that focus in trauma, in grief, in addictions, in children, in adolescents, in family therapy, eating disorders, and the list goes on. When someone comes into our practice for the first time and they say, "This is the issue I have," it's really our mission to make sure that they get with the right fit. One of the things that's really amazing about Resolve is that when you call, a clinician answers. It's not a secretary, it's not a gatekeeper, it's a therapist. And that therapist is going to be able to connect you with the right therapist in the group for the needs that you have. The third pillar that we focus on at Resolve is community outreach. We provide community education, we provide professional education, and we also volunteer with a number of different agencies in the community, providing pro bono services for their clients in both an individual and group setting.
So what I've seen in the past is clinicians who really have a passion. This is what I like to do, this is how I like to do it. And that's what you see them out in the community performing those actions. And our goal is to meet with partners and just to listen and hear, this is what we need, and this is just, no one's really come out and helped in this area. And so our focus is to take ourselves out of the picture and to just really fulfill those gaps in services that no one else is working on.
After doing this for a number of years, one of the things I know is that many people are apprehensive to seek services for the first time. There's fear around what it's going to look like. There's fear around what they might have to talk about. And we're passionate about making this process seamless. When you come in for the first time, you're going to be in a very comfortable setting with somebody who understands what you're going through. They are going to provide a listening ear and guidance around what you might be experiencing. They'll also, by the end of session, be able to tell you how often you might want to come in order to address some of the things that you're working through. They'll provide treatment goals and talk to you about the process. It's our goal to ensure that the client is well educated at the end of that first session, so they really understand what they can achieve when working with a Resolve clinician.